Hi everyone, I'm Nardine Nakla. Welcome to the module Decision Making and Documentation, Keeping It Simple Part 2. Upon completion of this module, you will be able to discuss the value of integrating routine documentation into your clinical practice and identify components of effective documentation. Once you have made a clinical decision, it is imperative to document the interaction in the patient record. Documentation serves many purposes. Documentation enhances our ability to make sound decisions and provide patient-centered care. With good documentation, we are better equipped to provide longitudinal care for issues that require multiple follow-up visits, such as blood glucose management or smoking cessation. Having a more complete patient record also contributes to future decision-making, as you will have a better picture of the patient's personal circumstances. Documentation also facilitates seamless transition of care from one provider to the next. This transition is most apparent when multiple pharmacists on staff provide care to the same patient population. Having good documentation allows any pharmacist to resume care for a patient at any time, even for particularly complex and challenging patients. This also applies when transitioning care to other healthcare providers, such as the patient's family physician. Documentation is a reminder of the accountability and responsibility we have to our patients. It serves as a check of our decision-making process and ensures that we are acting in the best interests of our patients. Documentation prevents unnecessary duplication of work. To you or another member of your pharmacy team, a clinical dilemma, such as a drug interaction alert, may appear to be unresolved if there is no accompanying documentation. Another pharmacist may then unnecessarily perform the same lengthy assessment as you, or you may end up doing the same assessment again if you cannot recall your past interactions with the patient. This process may give off the impression that your pharmacy is disorganized and damage your relationship with patients. It may cause confusion if there are competing plans implemented, and above all, it wastes time. Documentation is an acknowledgement of your contributions to patient care. There's a saying, if you didn't document, you didn't do it. Pharmacists devote much of their time to patient care and often do not receive credit for it because of poor documentation. Documentation demonstrates your value as an individual practitioner and also demonstrates the value of the profession to the healthcare system. Finally, documentation serves as the legal record of the healthcare you provide to your patients. If nothing else, pharmacists have a professional obligation to keep accurate records. This list is by no means exhaustive, but is instead meant to highlight some of the key reasons why you must document the care you provide. Ideally, every interaction you have with your patients should be documented in some way. The prescription hard copy serves as documentation for implied aspects of patient care, such as assessing the safety and efficacy of the medication for that patient or providing patient education. Additional documentation may be required for interactions that fall outside of this realm of implied care, which may include prescribing medications within your scope of practice and your rationale for doing such, collecting other relevant medical information through provision of care, resolving concerns regarding the prescription's safety or efficacy, such as responding to an alert from the narcotic monitoring system, choosing a plan from one of multiple reasonable solutions, providing a service that is not captured by the record of dispensing, such as recommending a non-prescription medication, or answering questions about the prescription that might reasonably come up again in the future. Next, let's discuss how to document effectively. There are many different styles of documenting, and the style you use will depend on your practice site, the type of interaction being recorded, and your personal preference. Regardless of the style, documentation should be accurate. Besides the legal implications of falsifying documents, inaccurate records can negatively impact patient care by influencing future clinical decisions with false assumptions or by impeding the care process through unnecessary clarification. This highlights the importance of proofreading your documentation before signing off and adding it to the patient record. Concise. The reader should be able to easily pick out the main points of your documentation. Extraneous information just distracts from the issue at hand. You are also less likely to document if your notes are wordy and tedious. Keep it simple and to the point. Rationale. Your documentation should have sufficient information to justify your clinical decision. The reader should be able to follow your train of thought and determine not just what you did, but also why. Easily retrievable. Your hard work in documenting will be rendered useless if nobody can find it. There are no profession-wide standards for where to keep documentation. Current pharmacy systems differ in their capabilities of storing documentation and are often not well equipped to handle free-form notes as you might expect to see in a patient's medical chart. Work with your pharmacy team to establish your own standards and workflow processes for your practice setting, such as making use of electronic notes features in your pharmacy system or having a dedicated filing cabinet for paper records. Also consider reaching out to your software vendors to enhance the capacity for patient-centered and retrievable documentation. You and your team should know where to find certain pieces of documentation when needed and be confident that you haven't overlooked any notes. Once you have set standards for storage, it is equally important to incorporate a review of past documentation into your routine care. Accountable. The writer and date should be identifiable. Some pharmacists are reluctant to sign their names on notes because there is this fear of being responsible or making the wrong decision. However, documentation is meant to be enlightening, not incriminating. Your documentation adds tremendous value to the healthcare system, so take ownership of it. Let's take a look at some practice examples to illustrate effective documentation for routine care. A patient comes in from her doctor with a new authorization for 3 months of all her existing medications, which includes ranitidine 150 milligrams, once daily PRN. She tells you that she doesn't need the ranitidine right now. Upon further discussion, you learn that she only takes it 2 to 3 times per week, and that is sufficient to manage her heartburn. You then place the medication on hold. On the documentation, you might record something like this. Patient reports adequate control with 2 to 3 tabs per week, RX placed on hold. This note may seem almost inconsequential, but it is valuable for several reasons. First, it provides your justification for not filling the ranitidine for the patient with the rest of her medications. Next, it allows you or the subsequent pharmacist to assess approximately when that medication will be needed. Finally, it provides a baseline usage to help track the disease progression in the future. This note was documented directly on the prescription, but you might also consider leaving a note electronically for ease of retrieval and visibility. Let's look at another example. A patient comes in with a prescription for Percocet 1 tab Q4 to 6H PRN times 15 tabs from the emergency department at the nearest hospital. When you go to fill the prescription, you receive an alert from the narcotic monitoring system that the patient may be double doctoring. You see that the patient also takes morphine SR, 15 milligrams BID prescribed by his family physician for chronic non-cancer pain and filled at your pharmacy every 2 weeks. You confirm with the ER doctor that the Percocet is for an acute pain condition and meant to be taken in addition to the baseline morphine. An example of that documentation might be, confirmed with Dr. Jones that Percocet prescribed for acute pain on top of morphine SR from GP. Also notified Dr. Taylor, GP, about Percocet RX, dispensed as written. This note was important to document because of a concern about the safety of the prescription, especially in the context of the NMS alert. It provides your justification for filling the medication despite the potential for inappropriate double doctoring. It saves you or the subsequent pharmacist from going through the same confirmations when the patient returns to fill his morphine, since another NMS alert will likely be generated at that time. It is also a demonstration of the pharmacist's value in coordinating care between multiple providers. Take a moment to reflect upon these practice examples. Have you encountered similar situations in your practice? What would you have documented in these cases? If you were looking for another pharmacist's documentation for these interactions, would you know where to find it? Before we close, let's look at a question to review what we've discussed in this module. Which of the following statements regarding documentation is true? There are profession-wide standards for where to keep documentation. The author of a note doesn't matter as long as the interaction is documented. Documentation is an integral part of the clinical decision-making process. Documentation must be lengthy to contribute to patient care. The answer is C. Documentation is an integral part of the clinical decision-making process. Once you have made a clinical decision, it is imperative to document your contribution to patient care for the benefit of your patient and the benefit of your practice. With practice and experience, you will gain comfort, having a more active role in advancing patient care, and will become more efficient at effectively documenting, with the goal of incorporating these activities into your definition of routine care. I wish you the best of luck.